Welcome everyone to today's webinar, How Dental Organizations Can Protect Patient Data and Reduce Cyber Threats. My name is Brian Zimmerman and I'm pleased to serve as your moderator today. So on behalf of Becker's Healthcare, thank you and welcome. Before we begin, I'm going to walk through just a few quick housekeeping instructions. So we'll begin today's webinar with a panel discussion, and we'll have time at the end for an audience question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you don't see your panelists here on the screen or any technical issues at all, audio-wise, otherwise, try refreshing your browser first. And you can also then submit any technical questions into the Q&A box. We got folks on the line who are here to help. So with that, I'll briefly introduce each of our outstanding panelists. So Daniel Mursky, Vice President, Information Technology with Sage Dental. Abhinav Gupta, CEO, SmilePoint. Bruce Schmidt, CIO, Dental Associates. Michael Irving, Chief Operations Officer, Community Dental Partners. Sandro Blaslov, Vice President of Engineering and Development with Rectangle Health. And Brian Doyle, Vice President of Enterprise with Rectangle Health. Before we dive into our discussion here, I'm going to briefly turn the floor over to Sandro and Brian to sort of lay the groundwork for our conversation today by providing a brief overview of our topic. So Brian, Sandro, take it away.
Thank you, Brian, and thank you for this great panelists who joined us today. We're pretty excited to go through this topic. My biggest takeaway from what we're going to talk about is with the coming of technology into the dental ecosystem, we need to make sure everything is secured, we're doing it properly, and this panel is much more educated on those topics than I am. I'm more on the provider side, the frontline side, where we're going to talk about having certain technologies, we have to have the protections behind it. So I'm pretty excited to go through what those processes are with this esteemed panel. So thank you all for joining us. We look forward to the next hour.
Thanks, Brian.
Sandro, go ahead.
Sure. Thanks, Brian, for that intro. And thanks to the panel for spending some time with us today. I think, the topic is near and dear to my heart because ultimately I think, data security is ultimately an engineering problem, right? And every solution, whether it's a hardware or software solution, should be judged and tested just like everything else we build. And when I look at that solution, I look at three specific areas that we might want to talk about a little later today is, the cost of the solution, right? How effective or how costly is the solution? We have a security solution that's actually eats up considerable cost and makes it difficult for an organization to make a profit. Chances are you want to look for an alternative solution, something that you might want to dive a little bit deeper on that solution so it doesn't eat up too much of your cost. The second thing that's very important to me is, how effective is that solution? So some solutions will just provide you a protecting your data in transit. Some solutions will encrypt your data at rest. But how far does the solution go to secure your data should always be considered. And chances are you'll probably have a combination of different products till you feel comfortable with the security solution that you're implementing. And the most important thing is obviously you want to always, audit your solution. Periodic auditing of your software or hardware solution is important. Identifying areas that need to be improved. You can always do that internally. That's great. Internal audits are fantastic, but we always suggest to get a third party involved and do those audits because one thing that's sure in engineering and software development, things are constantly changing, and the solution or the audit that you did a month or two ago is probably no longer valid. So you want to go back and look at that solution and make sure that it's rock solid. So yeah, excited to talk about this is again an engineering problem that we always try to solve for at Rectangle. So excited to hear about what the other panelists want to offer. Thanks.
Excellent. Thank you, Sandro, and thank you, Brian, for sort of setting the stage here. But we are going to have some more introductions here, but I'm going to ask each of our panelists to share a little bit more about themselves, of course, but also to dig in here and talk about maybe one or two most pertinent security risks they're currently working through at their organizations. Dan, I'm going to tap on you to get the ball rolling here on this first question.
Certainly. So I'm Dan Mursky, VP of IT here at Sage Dental. I've been here about 3.5 years, and let me tell you, we're based here in Boca Raton, and we're always, really highly focused on cybersecurity with 70-plus dental practices in the Florida, Georgia area. You're always looking at new threats and new ways to keep our users safe. And it's a challenging balance of keeping all of our data safe, keeping our patients safe, while at the same time still getting a good user experience for our end users. All the practitioners in these practices, you still have to give them a system that works and a process that works. So that's the biggest balance that I think that I face on a daily basis is, keeping compliant on all the different things, whether it's HIPAA, PCI, and just find that balance that keeps everything running, at peak performance while eliminating some of these threats.
So really balancing that sort of efficiency and efficacy with also security, right?
Most definitely. That's the biggest balancing act I think we have, especially all these different cybersecurity tools and swapping things in and out to try and find what's these new threats and 0 days and patching and making sure that all the systems still work after you've patched some of these older systems with new Microsoft patches. It's a balancing act for sure.
Thank you so much, Dan. Abhinav, same question to you. Just tell us a little bit more about yourself, and then talk about the 1 to 2 most pertinent security risks you're sort of wrestling with at your organization.
Absolutely. My name is Abhinav Gupta. I'm the CEO of a DSO called SmilePoint. Currently have around 25 offices spread across Texas, mostly de novos, a few acquisitions, and we'll be expanding into New Mexico next year. So really excited about that. As far as I'm concerned, I'm an engineer and MBA, and I was doing consulting and banking before I began managing SmilePoint 7 years back. I agree with the previous panelists that dental office becomes a busy place, and it's a challenge to balance the security needs with the business needs. As far as the 1 or 2 security risks that I'm really interested in learning more about is one on the external side, which is the ransomware. We keep hearing about it in the news. Are companies of our size really in the cross eyes of those hackers? And then another thing that's really interesting is how to protect ourselves from disgruntled employees who have access to servers.
Absolutely. Again, sort of balancing, as you said, the security needs and business needs, but also some of the more, I guess, scary things to think about: ransomware, hackers, disgruntled employees, also on your mind there. I appreciate you sharing that, Abhinav. Bruce, tell us a bit about yourself and what you're wrestling with at Dental Associates.
Sure. Hi, my name is Bruce Schmidt. I'm the CIO here at Dental Associates. In my prior life, I was CIO at a life science organization. We're a DSO organization, and I'm responsible for 19 clinics located in Wisconsin and Illinois, and I'm happy to be joining you here today. I think, as far as top security risks, at the end of the day, it's all about keeping our patient information safe. It's not just about HIPAA, but it's also about reputation and our what we owe to our patients, right? And keeping their information safe. And, I think the biggest things for us is, in our organization, we move very fast. In IT, we move fast. And, for me, it's making sure that even just starting at the core of it, our team is making sure that we think about security, in everything that we do. And in IT here, we have a motto: zero trust, security first. So we want to live and breathe that and provide that protection for our patient information.
Thank you. Important comments there around sort of the cybersecurity is also a component of patient care or the patient experience, right? It's something, I think the phrase you use, you owe to patients, right?
Absolutely. It's our number one priority when it comes to cybersecurity.
Excellent. Michael, how about you? Turning to you now, if you can share about yourself and any pertinent cybersecurity risks you're addressing.
Yeah, absolutely. Michael Irving, my former life, military intelligence in the United States Army, and building companies and having lots of fun. That's what I do. We support 76 offices, and when it comes to, I love jokes because security can be a very depressing thing. There's attacks from all ends, so I love jokes, and I'm constantly watching podcasts about security to stay up on all things. And there's one where a director of IT comes to the CTO and says, "I've identified all of the risks," and he says, and we put them in two categories: those who work for us and those who don't. And basically, everything's a risk. One of the key things, though, to me is always thinking, and I know it's been hit on a little bit here, always thinking about the end user. You can engineer the crap out of security. You can do all things, get all the right tools, spend all the right money, but never underestimate the power of creativity and ingenuity of the end user. If something isn't easy to use in a secure way, they'll find a way around it. And so it doesn't then become an us versus them. It becomes an us working with them to make sure that we engineer security as part of the way it operates and just the fundamentals. It needs to be, in essence, they don't need to think about it. They need to just enjoy using whatever the system is, whether it's the practice management software, their email, whatever it is. So that's one of the key places where we see most of the threats and focus on it. We have internal software development, so we're very focused on making sure that is just easy to use securely.
Thank you. Yeah, I think that's an important point, right? It's not so much that end users, it's not that they're necessarily creating risk because they're being malicious. It's just kind of human nature, right? It's just human nature.
They're just trying to get the job done. Yeah.
Exactly. Okay. Excellent. Thank you for sharing that, Michael. Sandro, I want to turn to you now and give you some more floor time to talk about this question from your perspective and tell us a little bit more about yourself.
Sure, yeah. Sandro Blaslov, the VP of Engineering here at Rectangle. Been doing software development in security space for over 25 years, doing various custom software development for financial services, e-commerce, healthcare payments. And that's kind of where I start with security is how, since we're a product-focused company, how do we get that software securely delivered and new product features delivered to our customers? And you have to have the proper process in place. It starts with code reviews that our engineering team will actually look at. No one person can get code into a system without someone else looking at it. So there's definitely more eyes. Obviously, more eyes are always good. So having a proper process there. And I mentioned earlier third parties. Third-party scanning tools are very important to make sure that you're actually capturing those vulnerabilities that you might be using in certain libraries, right? Making sure that that's documented and it goes out and it's fixed before it actually goes out and hits our production servers. So software development process is actually very important. And I keep going back to testing and auditing. That's, you could test everything manually. You can do it automated, but you can never do enough testing. So with the software development process that we have in place, it's, do your unit tests. The developers are great, but they may miss something. Then we have a QA team, so QA team will manually test that, act like that user, put your user hat and say, well, if I was a front desk office employee trying to take a payment, how would I behave? And then you just basically automate that entire process. And one thing that's constant, right, is change, right? In security, something is always being identified, and our developers really need to be trained on this proper security processes, and monthly, quarterly training sessions with developers is actually very important. So for me, it's all about, how comfortable do you feel about releasing that software? And I go back to, I would say I have to have that warm, fuzzy feeling before I actually pull the trigger on pushing the deployment button. But that's kind of where my approach is on this topic.
Very technical with the warm, fuzzy feeling. I appreciate that, Sandro. Yeah. I bet to your point, sometimes it is about intuition and also just knowing that you've done your homework, right?
Sure.
Excellent. Brian, turning to you now on this question before we move to the next one.
Yeah, fantastic. So I come from it a little bit different than everyone else. I've been in the patient payment, patient software, fintech world for about 13 years, specifically around dental. And I'm more on the front lines. I'm more with the the staff, the ops team, the finance team. So I rely heavily on Sandro and his team to guide the product that I'm theoretically telling our partners to use that is secure and buttoned up. But what we're seeing, especially in the dental world, is the need for new technology, specifically around engagement, frictionless, card on file, things like that. We need to make sure the provider's office have a secure system that is easy to use. I think Michael mentioned that. We have to make sure it's simple, but secure at the same time. So that's really the dance that we're going through between what the consumers are saying we need, which is all of the new technology, versus the software in place that makes it easy for providers to capture, store, and use that data securely.
Simple and secure, easy thing to remember, but also just thinking about how those are, they're related. They're not exclusive. They work together, right?
That's right.
Excellent. Right. Okay, so let's move to the next question that I have prepared, which is I want our panelists to maybe talk about the routines or practices for identifying potential data vulnerabilities in your systems and in your organizations. Dan, can we go back to you? I want to start with you here. Can you talk about just your general practices for trying to identify data vulnerabilities?
Certainly. I mean, I think it's very important. You have a lot of information coming from a lot of different sources. So, for us, doing our weekly DLP review, looking at what data loss prevention triggers have gone on, making sure that, our RCM groups, our claims are being sent in through secure email, not being sent, plain text. We do AD audits. So any changes that happen in our Active Directory, we want to make sure that we're auditing those, logging those, and making sure that the right people are making the right changes. And so, those are weekly reviews. And we also have aggregated a lot of our firewall data, a lot of our endpoint, and into one dashboard so that we can see really meaningful data, so that we can kind of hone in on where our problem areas are and see it very quickly and address it quickly. And then lastly, it's data backups and making sure that our data backups are happening, doing test restores, which, that typically with our user base, the test restores are real-time restores. So we get a lot of, we can kind of check that box just through a normal business. But those are, I think, the high points of what we're always trying to accomplish is making sure that we're reviewing these things, that all my IT groups are all involved and all have a voice to kind of really, hone in on what's really happening in the practices and in the back-end data center.
Thank you for sharing, Dan. Yeah, and to your point about audits and review, I think Sandro's point resonates, right? Like, you can't do enough testing. Auditing is really important. Abhinav, I want to turn to you now and ask you the same question about what your routines and practices are at SmilePoint.
Yeah, we consider them very important. So we conduct quarterly risk assessments where we review pretty much the overall infrastructure. As part of that, we review the current controls that are in place and weighing them against any potential risks out there. Broadly, these controls are divided into two categories, right? Technology-based and process-based. Your technology-based controls would include things like antivirus on each system and server, network firewalls. We want to make sure that they are updated with the latest signature files. Their logs are being reviewed, alerts are being checked, and essentially making sure that they're working as expected, right? On the process-based, those controls would include checking and making sure that, simple yet important things like treatment plans, route sheets, EOBs are not lying around in the office as stacked in drawers and closets, right? We want to make sure that they're being disposed of appropriately. We want to make sure that the password policies, yes, it's good they are there, but are they being enforced? Are the passwords being reset appropriately? And the access of separated employees is being terminated on a timely basis or not? Dan talked about backups, very important. So these would constitute some of the controls that we check on a regular basis.
Thank you for sharing. Certainly some crossover there. Bruce, can you build on those comments? How often are you doing these assessments, and what else are you doing? What else is in your security routines?
Yeah, definitely. So we're doing regular assessments. It really depends on how micro and macro those systems might be that determines how often we're doing those assessments. I think the one thing I'd I'd probably touch on, there's a number of routines we're doing, practices. I'd probably touch on our SIEM solution. SIEM stands for Security, Information, and Event Management. It's something we've invested heavily in. Basically, it's a solution that aggregates all of our log files from all of our machines into a single diagnostic engine that's being analyzed constantly. Out of that tool, we get automated alerts for any kind of concerning activities that might be happening that we can tend to, and it typically can also prioritize it right away to let us know if it thinks there's something critical going on. As you can imagine, there's a lot of machine learning and AI going on with some of these systems that can do some of those things. But in addition to that, we're not just relying on the technology to do this. We also have an outsourced provider that reviews all of the results of this log analysis on a daily basis as well, to make sure that we're taking action and that the algorithms aren't missing anything that might be critical. And so we're able to take action on that. This is also valuable to our audits that we have. So we can show and demonstrate that we're actually reviewing these log files on that daily basis. So your auditors will like to see that as well. Not only is it a good practice, but helps you there. On top of that, we get weekly recap reports, and I get an executive report from our solution and outsource provider on a monthly basis to be able to ensure basically at all levels that we're covering off any kind of potential vulnerabilities. And the solution's really at the center of our best practices in protecting us against any kind of compromise.
Excellent. Thank you so much for sharing, Bruce. Michael, can you build on the comments of your colleagues here on the screen?
Absolutely. A lot of the things I'd be saying would be the same things they're saying. So like you said, I'll build on it. One of the things that we do is oftentimes you can feel secure or have a false sense of security. And so I constantly, one of the principles I beat into was probably the wrong word or wrong phrase, but that I emphasize a lot is assume compromise. Assume that you're compromised. Just assume it. Just don't assume you're not. And that gets along with the trust no one concept. And then some of the tools that we use in order to do that is a technology called honeypots. So if you're compromised, and again, I say, don't say if, you're compromised, where are they, how they get in, what are they going after, and fix that. So learning from that. And that's actually one of the big things is we can take a lot of action. We can have a lot of activity in IT, and we can get lost in the details sometimes. So key to that is there's lots of ways to say it. There's experience transformers, AARs, after action reviews, postmortems. After every incident or everything that even lightly scares us, let's make sure we have an after action review where we're looking at it. We're saying, how can we get better? How can we ensure that this doesn't happen again? And then all of the great things. One of the other tools that we've implemented recently is antivirus has been around for a very long time, but there's newer tools that include the antivirus signatures, but also look at behavioral issues, if you will. So it looks at the behavior of a machine, and anything outside of that behavior, it assumes that that's not good and locks it down. So that's another tool that we've been implementing also. So again, trying to assume compromise, and then how do we make sure that that doesn't actually turn into a real compromise?
Necessarily. Thank you, Michael. I think quick follow-up for you. You said, you emphasized really that the necessity of that kind of mindset of assuming you're compromised. I'm curious what that, emphasizing that with your team, what does that look like? How do you try to communicate that? And are they generally receptive to that sort of type of thinking?
I find them to be very receptive. It's actually something. I find them to be receptive because it's not assume compromise and, oh crap, can't do anything about it, throw our hands in the air and run away. We take a very strategic approach. It's like, hey, it's okay. There's and I learned a lot of this in the military. Guys, don't just assume everything's safe. You're in your fob or your cob or whatever. You're within your walls. You've got all these protections. Who's the person standing right next to you? What's going on over here? Don't assume that you're just secure because you're there and then let down your guard. And so then what are the policies, procedures? What are the tools that we're using to look at that? And when they realize that they take that approach, everything looks like an opportunity to fix, as opposed to, oh, we're secure. Oh, crap, we got breached. Well, duh, we got breached. Like, those things happen all the time. What was the level of it? What was compromised? How did they get in? Who got in? Where did the data go? So and then there's all the tools needed to do those postmortems. But yeah, hopefully that answers your question.
Yeah, no, for sure. I mean, I think it just gets to like you're creating sort of a culture of vigilance, right? Like you're just trying to really have your team constantly look for places to shore up and get fixes versus assuming anything's okay. So
yeah, anyone who's been around the industry long enough, like we talk about what security vulnerabilities shock you. Like nothing shocks me anymore. This happens, but are we prepared to resolve it, to fix it, to respond to it, and more importantly, to learn from it? And if we're learning, then we're constantly leaning forward and saying, what's next? What are the new tools? And how can we help? How can we be in a better posture, a better position?
Thank you, Michael. And Sandro, I want to tap on you for this question as well. And really, I'm thinking about how you can build on this conversation sort of from the software development side, that perspective here around best practices and routines for identifying vulnerabilities.
Sure. Yeah, I think there was a couple of things that I already touched upon, such as patterns in your data and endpoint security. Right, your systems are always telling you something. They're if you're spiking always at 5 p.m. and that's a typical day for you, that's fine. But more importantly, you want to be able to have some sort of metrics against your daily usage on your servers, the data that you're collecting, and making sure that that's consistent with what you've seen before. But again, just you want to make sure that you just don't kind of like fall on your laurels and say, yeah, that everything looks okay, but you want to go one level deeper and say, all right, well, data looks fine, our traffic is fine. What else could possibly be going on? So you want to constantly look at your logs. Log aggregation was something that everybody mentioned earlier. One of the things that we do is, there is an issue and a postmortem that we have is we go through a timeline of events, right? And the funny thing is about postmortems, people think that you're coming to a meeting and they're going to blame you for the problem. Not necessarily true. That's the very first thing that I always do. Is okay, we're here to talk about trying to solve the problem or identify what went wrong. And we go through a timeline of events from minute one of what happened when we started to see the issue, and then we go through the resolution. And just going through that exercise actually identifies a bunch of action items that can be taken and then implemented. But it's important that once you have those action items, they're actually tagged with people that actually would go out and implement them. It's not safe to just list them and then walk away from the meeting. It's important to just tag a few people that would actually implement those action items so that and follow up on them as well to make sure that they're implemented correctly. But yeah, everything that everybody said, I mean, is important. Log aggregation is something that we're doing as well, and making sure that we can track our patterns on our servers.
Yeah, thank you, Sandro. An important point there around sort of making sure there's ownership around those action items, right? There's somebody's committed to doing something about it.
Absolutely.
Excellent. I want to move now to something, Michael, you sort of talked about this, sort of being surprised. The question I want to ask is, have there been any surprising data vulnerabilities identified in your respective organizations? And how did you go about addressing those? Michael, I'm going to put you on the spot there to kick us off on this question.
Yeah, absolutely. And this goes back to that thing where when you've been doing it long enough, you're not surprised anymore. But when you identify that security risk and you do what you need to, whether that includes reporting, whether you lock it down. And one of the ones that we had was really interesting, so that it was never actually a breach, but because and this was years and years and years ago, but we look at firewalls, and firewalls, just think of it as a firewall. We all think of it as a wall, and it also has that fire next to it or whatever. But it's got doors inside of it, all these ports and all these different things. These doors are built into it. And if you're not monitoring those doors, or you're not doing your audits or whatnot, your pen testing and other things like that, you don't even know some of these doors exist. There's actually protocols internal in your LAN that can open up doors if you haven't set up your configuration properly, and you don't even know that door is open at that point in time, and it is a security risk. So with that one, we actually found through another one of our log files that this door was being knocked on heavily for actually a significant period of time. Fortunately, the door never got opened, but it was being knocked on, and it was just a matter of time before that door opened up. And so what we did in that situation is found it. We actually just killed the door, modified the configurations, and we actually then in our postmortem looked at what was the problem, what are the solutions, and how do we ensure going forward we're not. So we actually shifted strategy altogether going forward and created a cloud firewall setup to where what was happening is we had so many different firewalls that we had to maintain the configuration files on. Instead, creating secure connections to a centralized firewall and then manage that one like a beast made our surface area reduce significantly and made the complexity of the security way easier to handle. So that was one of our scenarios, and again, it doesn't surprise us anymore.
Yeah, doesn't surprise you anymore, but you got to keep looking for it and address it. Yeah, appreciate that, Michael. Bruce, can you tackle this question too? What any surprising data vulnerabilities? Any specific examples you can share of how you've maybe addressed those vulnerabilities?
Yeah, I think to me it's less about the data vulnerabilities and more, those are typically more of a result of a root cause or a different problem. I would probably come at it more from like a process vulnerability perspective that ends up leading to those data vulnerabilities. And really what we do is we focus on audits of our processes and through our tools, looking for those exceptions, right? I mean, at the end of the day, it's probably about validating all the things you have in place, and a lot of times it's against the basics, making sure you're protecting your administrator accounts properly and auditing them, making sure new employees are set up with MFA. You go through all this work to get everybody on MFA, and you sure as heck better be setting up your new employees the same way. It's those kind of basics, terminating employee accounts in a timely manner. Are you using hardened images when you're setting up that server or that laptop? A lot of times, and a lot of times it's the exceptions, I think, that come back to haunt you. When you're putting a new system in place or you're trying to get something to work, the typical nature is to sometimes open something up or use some account that might have a higher privilege, right, to get it working. And it's making sure you're backtracking to eliminate any of those vulnerabilities that you might have potentially put in place, just trying to get something working, right? So again, those are usually the data vulnerabilities. Usually end up being a result of a process vulnerability and protecting against that and compromise. So I think that's what we focus on more is around those best practices and not leading to any kind of those data vulnerabilities.
So really identifying those process vulnerabilities, but also just making sure the basics are always taken care of, that nothing's sort of like taken for granted or overlooked, right?
Yeah. Anytime you hear, anything in the news about, some file being accessed that has millions of records in it, right? That's as a result of some best practice that probably wasn't being followed.
Right. A lot of the times it's just the simplest thing that it's just missed, that everybody already knows it's something that needs to be taken care of.
Exactly.
Appreciate that. Abhinav, what about you? Any surprising vulnerabilities you've identified or addressed?
Yeah, I'll add on to one of the process-based vulnerability that we encountered. So a few years back, we began offering an in-house payment plan to our patients. It was a hit. Both our patients and teams loved it. Just from the business side, one of the most disappointing things that we run into is that when we spend hard marketing dollars, we generate those phone calls, bring in the patients, and we deliver good patient experience, doctor does the exam, and patient is ready to get the treatment done. But at the last minute, the treatment planner walks out saying, "Oh, I'm afraid I couldn't get the patient financed." That is so disappointing to see that patient walk out, right? So in-house payment plan, one of the very good things that we did. However, a few weeks down the road, we realized that our teams were saving the credit card details on Excel files. So of course, alarm bells went off, and we immediately switched to a third-party platform with the recurring payment feature. making sure that nothing is saved locally at our end. On top of that, we implemented a process control where since then, we now check for any sensitive information in our files, making sure that, number one, either it's not stored. If it is stored because of a business need, then there are appropriate access controls built around it. But the key point here is that I would like to hit upon is that, dental office, I think we are better off focusing on our core competency. And for anything, if there is a technology-based solution available, then I think we are better off leveraging that.
Makes a lot of sense. So really, and that goes back to sort of transitioning out to the third party and having them look at it. Would you say, what was that process like? Can you discuss that just a little bit?
Process that we were using earlier, or the one that we
or working with the third party, bringing the third party in. Was that well received?
It was pretty seamless. I mean, third-party payment platforms are pretty mature these days, and we didn't run into any issues since then. It's been pretty seamless. And the good thing is we have preempted the threat of sensitive financial information getting exposed from our end. I think that itself is a big positive as far as we are concerned.
Absolutely. Thank you for sharing that, Abhinav. Dan, turning to you now, can you talk about any surprising vulnerabilities or just any experience you've had trying to address vulnerabilities you've identified at your organization?
Certainly. It's funny because as all my colleagues here have been going through some of these things, it's all of these things on any given day. But Mike touched on one that's really, I think, we really should focus on is a formalized RCA process. What are those remediation steps? What was and doing a full post-mortem? And that's on anything that happens, whether it's an outage, whether it's a cybersecurity event. And I think that's what really kind of helps you learn and get better and kind of get the whole team involved in that event. But I can tell you one of the things we've been struggling with that we're seeing is the targeted phishing attacks. I think about 25% of our mail we've looked at on any given day is valid. But we get 350,000 messages a month, and only 25% of those are valid. So we're kind of getting those out of the users' email boxes. We're trying to keep them from clicking on things they shouldn't click on, and we're seeing a lot of credential harvesting. We're seeing people, like anybody that has Office 365, they're going to present them a screen, and they're going to log in with it. And it's giving them the awareness to see that that is not truly Office 365. And so we're seeing a lot of a really big uptick we're getting about 20 to 40 users being hit on a weekly basis outside of email. Just they're going from Gmail addresses. So it's very targeted attacks that are happening. And I think you guys have hit on a lot of that stuff. If you're not looking at those firewalls, what's actually knocking at the door and you're not aware, it's not if, it's when. We're all going to be hit with something, and it's being diverse enough to kind of pivot and just try to take that step back and look at it from a wide lens and see all the different ways that these things are happening, and then be able to react to them quickly. As far as if one user reports that they saw this targeted attack, now we're going back, we're trying to identify those addresses, where they came from, and who clicked, who opened those messages. And it's challenging. That and just really kind of educating the end users on, again, sending things securely, using a secure portal or a secure email as opposed to just sending patient data or sending out your claims. All those things have to be done in a secure manner, and we're keeping them from doing that. Kind of really putting those guardrails on our user groups. And again, I think I touched on this earlier, patching. In general, we're looking at some of these old antiquated systems, and you've got a lot of things that are being patched from Microsoft and put in whatever vendor anywhere. And what's end up happening is you're patching these new systems, but then these old systems could break. So it's really trying to find that balance of patching, keeping everything patched, and we have multiple systems. You have to dedicate a lot of time and resources to keeping everything, your whole environment, up to date and patched. I think that's the things that we've kind of really been focusing on lately.
Thank you for sharing that. Yeah, and the if not, it's not if but when sort of goes back to the comments from Michael sort of around assume you'll be compromised. And when you talk about the volume of phishing emails, it does feel just kind of like a numbers game sooner or later. I appreciate those comments, Dan. Brian, I want to turn to you now and have you weigh in on this question before I move to another one for the group.
Yeah, absolutely. I'm going to kind of piggyback on what Bruce and Abhinav said is around the front end user experience in the process. So the card on file, things like that, they're commonplace in today's consumer environment. Whether you think of Amazon, whether you think of booking a hotel, whatever it is, it's commonplace. However, the amount of cards on an Excel spreadsheet or being emailed back and forth, or an ACH account number being emailed from the clinic level to the corporate level is staggering. And that to me in the payments world is a major concern. So what we need to do is, and we're going to talk about this, I think, at the last question, is one, educate the staff. But more importantly than that, give them a seamless process, a secured seamless process where we are going to do a payment contract, or we are going to do a recurring payment, or keep a card on file, or pass tokens from clinic to corporate, we need a seamless transition. And that's really what we concentrate on, is providing that and really instructing the staff member to, in fact, use it the proper way. And we remove any of the manual effort out of it. Because the thought of sending 500 recurring payment plans via an Excel spreadsheet, via email, not great. That's something I highly recommend not to do. So we need to automate that and make it more streamlined and give the technology that is available. There's a lot of really good vendors out there. It's available and it's widely used and significantly secured, because the softwares are up to date on all their certifications, on all their compliance, and the HIPAAs and the PCIs of the world. They make sure all of that is buttoned up to remove that manual entry at the clinic level.
Appreciate that. And Brian, to your point about sort of there's a wealth of good vendors out there, but I imagine folks want to figure out how to home in on those vendors and really identify them and find them. So I think that brings me to the next question I want to pose to the group, which is, how do you identify these vendors and systems that will help secure patient data? Dan, I'll throw it to you to kick us off on this question.
Certainly. I think one of the best examples was during COVID. We had to be very nimble and come up with some really innovative solutions pretty quickly, whether it was teledentistry, virtual waiting rooms, remote dental monitoring, different ways that we could service our patients and still, keep them safe. And so you look for vendors and partners that you recognize that either they recognize the NIST framework or some of these basic security type things. So it's mostly a discussion at first. Are they complying with HIPAA and PCI compliance? Do they have policies and procedures around those things? And in some of these cases, you're finding smaller vendors that really have great services, but their security is a little bit lacking. And so we find that, and you kind of see if you can educate them to a point where they can be secure, or you have to kind of move on. And once you get past that BAA, you have to just have a deep discussion with them and just make sure that that they can live up to that same level of security, or you have to look for the next one that will. And that's the hardest part, is really finding that right partner that can do that for you.
Thank you, Dan. Abhinav, you talked about your experience with a third party. Is what Dan just said resonate with you? Anything you can add to that?
I believe this is a challenge for us because, yes, there are certain vendors out there that are pretty mature and they take security very seriously. It has evolved over the years. But then there are vendors who are just starting out, who just completed their beta testing and came out with the first product. And they're solving some real business problems, then we are really interested in engaging with them. But yes, are we looking at their security as closely as we should? Probably not. So I believe that is a challenge, and I'm really curious to see what other panelists have to say, and maybe I'll take away something from them.
Thank you, Abhinav. Bruce, then I'll turn to you, and same question. Anything to add?
Yeah, what I try to do, and I would suggest, is you put them under, when you're going through the evaluation process, put them under the same microscope you put your own organization under. You know, we know we are so critical, I think, of ourselves when it comes to making sure we have the best practices in place. Let's do it with the same. Let's do that same thing with our partners, potential partners. You know, we've seen this year alone, there's a significant precedence for third-party tools and vulnerabilities around supply chain attacks and things like that. So it's more relevant than ever to make sure we're doing due diligence. You know, one of the things I do is I ask about their compromise history, you know, and if they're forthcoming about being able to share that. What are their security practices around protecting their own systems as far as policies? It's the same things we're asking ourselves here, right? And asking those vendors if they're doing the same things. You know, do they have multi-factor authentication? You know, I also talk about security certifications they may be running their organization against, and certain levels of SOC compliance. You know, and most importantly, how are they going to handle my data if that's their what I'm looking for them to do? And like Dan said, you know, around HIPAA and PCI compliance, what's their data loss prevention strategy? How are they doing encryption in transit and at rest? And you know, and the other thing is, when you end up leaving that partner for one reason or another, you know, making sure they're going to destroy your data on top of it, because the last thing you want to do is have a former partner holding on to information that is just sitting out there, and then via a compromise they have access to. So it's one of those boxes you definitely want to check. And, you know, so I would just say put them under the same microscope we're critically putting ourselves under.
Thank you so much, Bruce. Some concrete takeaways there. Appreciate it. Michael, turning to you then, anything to add on this question? How do you go about identifying vendors?
Yeah, so all of the things that have been said, fantastic. And then one of the key things that we look at when we're evaluating vendors now, again, there's lots of great vendors out there. Reputation is a big thing. But one of the things we're looking at is scalability. So earlier I talked about the system needs to work for the end user. It needs to work easily for the end user and still be secure. And so we're evaluating our vendors on that same thing. Can this piece of software be utilized, is designed to be utilized by the end user at scale? It needs to be easy to use for the end user, and needs to be easy to administer at the organization. And if it's not, it could be a great piece of software that's perfect for 1 to 5, or small groups, if you will, 1 to 5 practices. But we're not dealing with 1 to 5 practices. It needs to be. We go through all of the appropriate checks for all of their compliance and whatnot, but in reality, you can have all of that and then have a simple username and password to get in, and there's no way to have individual accounts, which on a single practice is HIPAA compliant. At scale, it's not.
Absolutely. Thank you, Michael. I've got one more question for the group. But Brian, I want to give you a chance to weigh in on this as well. You know, your final comments on the last question sort of kicked us off on this road. But can you talk about, from your perspective, how folks can identify vendors?
Absolutely. And, you know, when I talk about this at any level of dental or any level of healthcare for that matter, it's about experience. Is that partner, vendor, experienced in what you're doing and what you're trying to achieve? That's step one. With that, Michael just nailed it. Scalability. What is your software designed for? Is it designed to go up market or down market? It's okay to be one or the other, but it can't be both. So are you built for scale? Thirdly, the certifications, that all these acronyms that we're throwing around, right? How are we educating why that stuff matters? And does that vendor have those certs ready to go and are updated on an annual basis? Lastly, I would say they have to become a partner. We're talking about data security here. This is not, we could go find a data security payments vendor that's a commodity that's easy to get, like we can, I don't know, a pair of glasses. They need to become an extension of the organization. So I think all of that matters, and it should be fairly straightforward in how it's presented, that they can be built for scale, they have the experience, they have all the certifications that are required, and that they want to become a partner and are in this with the provider. I think those are the big four that we look at on a day in, day out basis.
Excellent. Thank you. Thank you so much, Brian, for putting that into the four concrete things our attendees out there can sort of take away from this conversation. The final question I have for the group then is to also get back to something, Brian, that you mentioned in a previous answer, which is about sort of educating employees about ransomware, malware, social engineering, and all the various cyber threats that sort of float around out there. So Michael, can we start with you? We're running tight on time, but I do want to give everyone just a chance to quickly speak to this. But Michael, I'm going to put you on the spot to get us going. How do you educate employees about these various?
Yeah, absolutely. The foundation of educating employees, one, there's requirements that we have to educate them. And so, yes, there's all the courses that they have to take when they're either first onboarded, then annually and whatnot. But in reality, it goes right back to that same thing I was talking about. We choose our vendors, choose our software based on ensuring that it's easy to use and secure in its use. And so that puts the onus on us. That being said, then we make little education snippets, almost like social media, right? 30 to 45-second snippets that we get in a data stream in front of our users to constantly remind them of it on top of all the platform. So those would be the way we educate around those things.
Excellent. Thank you. Succinct. Appreciate that, Michael. Bruce, to you now. How do you educate employees about ransomware, malware, and these various threats?
Yeah, this is the hardest part, I think, of security protection. We can put all the tools we want in place with the proper budget. At the end of the day, this becomes our biggest vulnerability, right? And it's people want to do a good job and do the right thing. And the good news, I guess, if there is any good news, is ransomware and breaches have become so prevalent in the news, right? So it's actually become more a part of everyday conversation. And so we can use those as examples of, this is why it's so important that you follow these best practices, because you can see the impact of it. For us, it starts on the first day of employment with phishing training, and then, elevating it from there. We take advantage of October being Cybersecurity Awareness Month, right, to push out education and, about the standard things around, password strength and not trusting open Wi-Fi, and things like that. And we also do the phishing simulations on top of that. So start the first day, but then build on it throughout the course of their employment.
Day one, get them going on it. Appreciate that, Bruce. Abhinav, how about you? How do you approach this education component?
Yeah, education is important. So like other panelists, we provide training to our employees geared towards HIPAA, covering all sorts of security and privacy risks. Training starts at onboarding, day one, and continues throughout the employee's journey with us. But I'll take a minute to talk about some of the challenges here. So yes, we like to train our employees, talk about the importance of security, but at the same time, I feel two challenges because of which employees have tough time keeping security at the forefront. Number one, because of the dynamics that exist in a dental office, employees are usually short on time because of just how the nature of the office is, because of which they always can do justice to security. On top of that, in the current environment where it is so difficult to hire employees, we are further shorthanded, making this situation worse. Second challenge is, which I find very interesting, is that the inherent asymmetry in the area of security and privacy. So if we follow all protocols and we do everything right, what happens next day? Nothing. Nothing happens. That's a win, right? Nothing. On the other hand, if we mess up, then we experience very adverse outcomes. So how do you motivate the employee to do the right thing? You motivate them on hitting the production target, collection, patient experience, case acceptance, right? But I'm here to run into someone who incentivizes their employees on having the strongest password, right? So how do you motivate people to follow the security protocols? That to me is a challenge. So what I'm trying to say is that yes, training is important and we have to keep doing it. but at the same time, better to use technology and preempt the threat as much as possible and depend on audits and security controls that prevent those things.
Yeah, so some real barriers to education there when sort of, to your point, Abhinav, success, when you're being successful, it's almost kind of invisible, right? The no news is good news phenomenon. But to your point, that how you maybe account for that is just making sure everything you can control for is controlled for, right?
Absolutely.
Excellent. Thank you so much. Dan, turning to you now, how do you approach this education piece?
Yeah, I mean, Abhinav kind of hit the nail on the head. I'm the biggest proponent, being from IT. It's not usual that I want the end user experience because they're patient facing, they're out there. So it's a balance. It goes back to the balancing act of giving adequate training and using an end user awareness system that doesn't it's not daunting. You give them bite-sized little lessons, whether it's about tailgating, whether it's about and being very diverse about the types of things that we're training on, but giving them 2 minutes, 3 minutes a month, and just getting that training out there, doing the phish testing, kind of identifying the people that probably need to be remediated. So we have systems in place where when we have these phish tests go out, especially coming up at the holidays, we're going to see a lot more of like the Amazon, the FedEx, the UPS emails coming through that are just phish emails. And so it's really, really important to still drive that stuff home, even though you have that balancing act in the practices. And so, yeah, I mean, just really identifying with some of this remediation training, we kind of know the ones out there that we really need to kind of give more training to, more education, but just being vigilant and kind of just keeping with it.
Thank you, Dan. I appreciate that. And also, I know we're coming up close on time. And I want to throw it to Brian and Sandro potentially here too for some final thoughts on this question. But I just also want to say, folks who have submitted questions or any type of engagement, Beckers will be happy to facilitate further engagement after the webinar. I know the conversation we've gotten into the thick of it here. So appreciate everyone sticking with us. And Brian, I'll turn it to you for any comments on this question, closing comments, or Sandro as well.
Yeah, Sandro, you could take it actually, if you don't mind.
Sure. Yeah. No, I think everything that everybody said is from day one and educating the employee on proper processing, protecting data, and cyber awareness is spot on. But one of the things that I've seen that works in the past is when these messages or emails are sent from IT managers, a lot of people read them and they love them. That's okay. We get it. That person is the person that's responsible because it's their job to actually promote the security. Well, once an email comes from C-level folks such as the CEO, the COO, or CIO, right? People pay attention. So getting these messages about being aware of security risks from the non-technical people, from the business side, is really important. I think people pay attention to that once that email is actually delivered to the inbox, that they need to be aware and be more secure or protect the customer's data and their own data. So I've seen that work in the past where getting emails from the business side actually works and people pay attention. That's an important part, though.
Thank you, Sandro. Appreciate everyone's time today. It's been a fantastic discussion. That we are at time. I want to respect everybody's time. I know everyone on the line is busy. So I want to thank all our panelists once again for an excellent conversation. And I want to thank Rectangle Health as well for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you for joining us. We hope you have a wonderful afternoon.
Thank you.